Namaskar and welcome to India Science. It is our endeavor to take scientific temper to the masses.
As we all know that coronavirus disease 2019 caused by SARS-CoV-2 virus is the latest threat whose clinical and epidemiological characteristics are still being documented. The disease is spreading rapidly and the number of cases is rising in most of the countries and in India as well. The disease can manifest as mild flu-like symptoms and in some cases even as gastrointestinal symptoms. The respiratory diseases in severe form can manifest as acute respiratory illness and pneumonia. The potential for foodborne transmission is a concern with every new emerging infection. In the wake of current pandemic, the provision of safe and hygienic food and nutrition-rich diets for better health has gained even more prominence. Today, both policymakers as well as the public have perceived that public health services and food safety are integral to governance as well as to the well-being of the society at large.
Amidst many challenges, this pandemic has also offered an opportunity to strengthen India's food safety ecosystem. It has underscored the need to mainstream food safety in the public discourse and recognize that every stakeholder has an important role to play as we continue to work together, especially in the food sector. Our topic today is Science Behind Food Safety and Hygiene in COVID times. I now introduce the panelists. Dr. Pulkit Mathur is a senior faculty at the Department of Food and Nutrition, Lady Irwin College, University of Delhi. She is a senior technical advisor, National Center for Excellence and Advanced Research on Diets, and has 20 years of experience in research and teaching. A gold medalist from the University of Delhi, she has to her credit more than 80 publications in national and international journals. She is presently on the same track. Thank you so much for joining us.
Thank you.
Namaste.
Namaste.
Also joining us today is Dr. Rubina Shaheen, a medical doctor with a master's degree in MPH Health from Johns Hopkins Bloomberg School of Public Health, Baltimore, Maryland, USA, and also possesses a doctorate degree in clinical microbiology from the SKIMS Sora, Srinagar, Kashmir. She has technical and administrative experience of more than 22 years in public health sector and food safety and has a number of research publications and books to her credit and is also a member of the Indian Public Health Association. She's currently working as Technical Director with Food Safety and Standards Authority of India for the last 4 years. Namaste and welcome to the program.
Welcome.
My first question to you, Dr. Pulkit, is, and rightly so during this pandemic, I think it's a very relevant question and everybody would like to know, does coronavirus really spread through food?
It doesn't really. As of now, we have no scientific evidence that coronavirus spreads through food. So there have been, some reports coming in from China and which has created a lot of panic. But it has not yet been proved by scientists. It could be just a case of, surface contamination because some droplets fell on the food. But till now, we at least do not have in scientific literature any evidence that it is either spread through food or its food packaging.
All right. And then Dr. Rubina, my question to you now is, tell us more about foodborne transmission. And how do you look at the whole scenario, because it is a concern in the emerging infection?
Right. Yeah. Since, as Dr. Pulkit said, that we don't have any scientific evidence behind coronavirus is spread by food, but there are viruses which do spread through food and water. Like we have hepatitis, we have norovirus, we have other viruses. Since we know that viruses usually don't multiply within the food itself, but they require some host cell for multiplication. So till now, as far as coronavirus has been seen, it doesn't replicate as far as the food is concerned, and it doesn't go and get transmitted through food. So, but there may be concerns, since this are till now we don't have an evidence, but science, we still are in the phase of development. So till now we should not have any concerns regarding this.
But then a sub question to that, which is regarding what you just said, that the other viruses spread through food. So the mutation of COVID, are you trying to say, has not gone into that area that we need to be concerned about food? However, what would you like to say about virus as a general for the viewers? How do you explain a virus, if I'm asking?
See, that's my point. Virus is actually, it's an RNA or it can be a DNA. It's a fragmented part of a genetic genome. So it only will replicate once it goes into the host cell, and it gets imbibed, or it gets inside the cell and take the part of the DNA from the host cell and then replicates. So till now we have seen that as far as the COVID virus is concerned, it doesn't have that much. That way it doesn't go. It directly goes to the transmission through, say, respiratory tract or direct human to human transmission. And whereas indirectly it can also come into contact. Person can come into contaminated surfaces and then take the virus. But as far as food is concerned, that has not been the mode of transmission of this virus.
So another question to you, and then I'll come to you, Dr. Pulkit. This is animal to human transmission also, COVID, as we speak. So there are a lot of people who keep pets at home. How would you like to quantify that statement? I may be just feeding my dog, and I may be prone to that kind of infection. This is also a concern among the masses. How do you explain that?
Yeah, there are some reports that it is been seen, the COVID virus has been isolated from pets as well. But that again will be the transmission from animal to humans, or we can say not through food itself. So, but it may be because we are in contact with the animal, or if it is a pet animal, or it can be any other animal. But as far as the food producing animals are concerned, so that is not right now an issue. Pet animals can be, yes, but still we don't have. We have some. Yeah, we have some reports that pet dogs and cats in home can be.
USA.
Right.
Yes. And on that note, I'd like to ask you, Dr. Pulkit, how would you like to explain sanitizing food products? Because people have become in a frenzy, or, they've started sanitizing fruits and vegetables. Yeah. Is that correct?
No, that's not correct. In fact, I really want to get that message across. It's just good enough if you thoroughly wash your fruits and vegetables under running water. You don't have to put any disinfectant or soap and other things which people are putting. There's a whole list which keeps on circulating on WhatsApp, and people just follow that. You see, when you're using other chemicals in contact with your food, then you have the other problem of getting these chemicals come into food and you being poisoned by those chemicals. So that's an even greater danger. So since it's not been detected in fruits and vegetables and other food items, you don't have to sanitize them with some chemical. At the most, what FSSAI does say is that you can use 50 parts per million of chlorine. You may dip the fruits and vegetables in that if you're really concerned that probably from the source where you've obtained your food, that's fruits and vegetables, that the vendor was having the disease or something. When you're really concerned, then you may do that. But otherwise, just washing them thoroughly, rubbing them under running water, and that's good enough.
And what happens to people who are living in containment zones where there is a high degree of COVID spread, and there are these fruit vendors and vegetable vendors there? What should they do? Because that is again one very important thing that we need to talk about, because they're asking these questions.
Right. So then that's what FSSAI does recommend, that in their guidance note, that you can use 50 parts per million of chlorine, and you dip it in that.
But the sanitizer as such has more chemicals and alcohols.
Yes,
is that what you're trying to say?
There are other chemicals, and you shouldn't be putting that in contact with food, because the food can then absorb those chemicals and then give you chemical poisoning. So that's not a good idea at all.
A very valid point. Dr. Rubina, I'd like to know from you, what are the critical steps that FSSAI has taken to ensure that there is no foodborne transmission of this disease?
Yeah, but what actually FSSAI definitely took a lot of steps only to facilitate food businesses, because that time there was the supply chain really got affected with that initial phase of lockdown and all that. So the important steps which FSSAI took was to just facilitate that the supply of safe and wholesome and nutritious food is not stopped. So that was initially we did was that import and lab testing was made as an essential service during COVID-19. So these clearances, import clearances were given preferences, and we even allowed provisional clearances for some of the food items which were imported, like crude oils and grains. And before, because normally what we do when the import happens, that has to first get tested in the laboratory before it comes into the domestic market. So in that case, we did a provisional clearance for some items which were very much required. The another step which we took was that especially those food businesses which were in the logistics supply chain, excluding manufacturers, they were allowed to operate even despite if they didn't have a renewal of their licensing, or they have already applied through our FLRS system. That's an online system for this license and registration, except for high risk foods where we did inspections for processing of applications. Then one more thing was what we did was to make all our government as well as the private accredited labs which are notified by FSSAI, they were made functional, completely functional as far as the staff and other people were concerned, that because logistically we have to have a staff there, we should have all the lab equipments and testing material should be available. So that was made essentially available to them. Then after that, we also have the training program which we have which is called FOSTAC training program, where the food handlers were trained on how to prevent COVID-19 as far as the co-workers and during working hours is concerned. So that training module was developed as an online module, and Dr. Fulkit can very well talk about that because she has been very much involved in
the training.
Yeah.
And on that note, we're going in for a very short break. Stay tuned. When we come back, we will talk more about food safety practices and training.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back. We're now talking about the science behind food safety and hygiene. And just before the break, Dr. Rubina told us about all the labs that were working during Unlock 1.0. And now as India looks at 4.0 Unlock, we talk more about safety and hygiene. She spoke about those labs. Dr. Pulkit, would you like to quantify about the training of the people concerned, because that is an important issue?
It's a very important issue because, the people who are actually handling food, unless they are trained in all the food safety and hygiene measures, it's pointless, just, talking about it scientifically. So it's the actual handler who's going to cook the food, who's going to serve the food, who's going to pack the food. So under FSSAI, there's a system called FOSTAC, which is training all these food handlers. And there are many training partners who have joined with this program, and my college is also a training partner, and I'm personally a national resource person for this program. What we do is we have made this module which is training food handlers and food business operators on what are the precautions that they should be taking when they are preparing food, when they are serving food. If they are retailers, what should they do? If they are actual, like a restaurant or a takeaway, what should they do? How should they deliver such food? How should they handle what temperatures they should cook their food to? How should they sanitize everything? How much, how to maintain social distancing within the food business. When people are there, so many handlers working, so they should be 2 meters apart. So all those precautions, and there's a whole guidance document which has come out with this regard as well.
Absolutely. As you said, those parameters and verticals need to be taken care of. Another question to you, Dr. Pulkit, which just came to my mind is that when you train these kind of vendors and street food people, or, say in Mumbai on the streets, or in Dharavi, people who have been affected, how is it that you make sure that you get across to every vendor? Because even one person making a mistake pan-India can cause disaster as far as COVID is concerned, and we can see the numbers rising. So how is it that you manage to take them on an online conference? What is it that you do that more and more can join this effort taken by your esteemed organization, and which is under the Government of India?
Yes, so we do try to get in as many as possible. Of course, we have not been able to cover everybody. So as of now, people who are volunteering, the food businesses who are wanting to do this training, they have been approaching the different training partners. Because people are not yet allowed to go out, and you cannot hold this training in physically as of now. We are not permitted to do that. So online, we have these check systems of asking questions, going to each and every person in that group and asking them questions individually, so that we know that they are understanding what we are trying to tell them. Then all our slides, everything is all very visual, and we explain it to them in their local language, so that that point is driven home that this is to be done. Otherwise, it's going to be very dangerous for you as well as your customer.
Very correct. And on this note, I'd like to ask you about hygiene, Dr. Rubina. What is the importance of surrounding hygiene, and what can go wrong if proper hygiene by a food producer is, say, not maintained?
Yeah. See, regarding the surrounding hygiene, we already have in place the Schedule 4 requirements, which is like a food business operator need to have a food safety management system plan in place. So in that he has to follow all the Schedule 4 requirements, which are all the hygiene requirements to maintain hygiene, because these requirements come under licensing and registration for food businesses regulation. So unless and until this food safety management system plan is not in place, he cannot be registered or given a license to produce any food. So all these requirements are like we have surrounding that will actually ensure that food production is in a hygienic way. So as far as the personal hygiene, that is a part of this Schedule 4 requirement. So under this Schedule 4 requirements, he will have to see where the location should be, where the food business should be located, and what should be the infrastructure, and how the processing area should be maintained clean and hygienical, so that once the production is done, it should not contaminate the food, and there should be no cross contamination. In addition to that, the Schedule 4 requirements also talks about the personal hygiene of the food handlers. So they have to be hygienic, they have to follow all the hygienic, like they have to clean their hands once they start the processing. Then they also don't have to wear these like jewelry items and all that before coming to the production area. They also have to put all the gears like head gears and mask, and especially during COVID-19, we also encourage them that they should wear all these like mask and hair, these gloves and all that. In addition to that, they also cannot have food and chewing gums and other items during production phase. So this is all what is in the Schedule 4 requirements. And in addition to that, there has to be a pest control mechanism in place for a food business operator. All the vehicles which are being used for transportation of the food, that has to be kept clean and hygienically maintained. All these are to be followed for keeping all the surrounding hygiene proper.
There is the science behind GHP and GMP practices. Please decode the same for us.
Yeah, sure. just in the previous question, I answered that there has to be a food safety management system in place. So these are actually the prerequisites for this FSMP plan. That is, person should have a good hygiene practices, and at the same time good manufacturing practices. So these are part of this hygiene practices, and these manufacturing practices can be which will ensure us that the food is produced in a hygienic way, and this has not the direct impact on food safety. Whereas we have one more component in this, that is in hygiene practices, is the HACCP, that is hazard analysis and critical control points. So that is this actually is a program wherein a food business operator should know where the food hazard can enter into my food production chain. So that points, if he has to know, he also should have in place the mitigation plan or strategies that how I can prevent this, because at times it may not be under his control to prevent the hazard, but there may be some strategic plans whereby which he can use, like we have temperature control, especially that food has to pass through this much of temperature, like we have in milk. Pasteurization is one of the point where we can do a pasteurization to prevent the load of bacteria in the milk, which otherwise cannot be done if we usually do it at our home. So pasteurization do kill many of the bacteria, including like what we have seen, tubercle bacilli, which are usually present in milk and all. So this is how the critical control points have to be identified by the food businesses so that they can prevent the entry of hazard in the food.
Yes, absolutely. On that note, Dr. Pulkit, I may like to ask you to add to what she said about the hazards that you feel, since you deal with a lot of adolescent children and you deal with a lot of teens and people who are very susceptible and not aware of food safety and hygiene. How would you like to address that?
So we need to understand how our food is really getting contaminated. So there are three ways that this cross-contamination can happen. You can get all these hazards into your food coming from another food. So food to food, there is surface to food, and there is hand to food. So these are the three main ways in which food gets contaminated, and everyone needs to understand that. So food to food, you have to take care that you're not from one food which is contaminated, you're not going to transmit it to other foods. So we always say that, wash your starting ingredients, your raw ingredients have to be thoroughly clean. So that's where washing thoroughly grains, vegetables, fruits comes in. Okay, and there's also a concept of keeping non-veg, that is raw meats, away from the vegetables. And that's not for any other reason, but for the fact that the raw non-veg foods tend to have a high microbial load. So when you put them in close contact with each other, which means you are using the same plate or you're putting it on the same chopping board or even using the same knife to chop, the microbes can get transmitted from one to the other. Surface is any surface with which food is going to come in contact with. So it could be your kitchen counter, it could be the chopping board, it could be the mixie, it could be anything, any utensil also. So if that is dirty again, or you're using the same utensil which you use for something which was not clean, and then you put your cooked food in that. And of course, personal hygiene we have spoken about, hand from body of the person who's handling to the food. So these three things are very important. And the only thing actually which saves you from most of these diseases is washing your hands. And we've been trying to promote this so much all over the years. People do not listen. If you have to wash your hands, they'll just quickly put their hands under water and come out and, soap thoda se lagaya, and then, you just wash it off. So then this whole concept, of course, COVID has helped that people now are washing their hands the proper way and for a longer period. In fact, now latest WHO has actually increased the time for which you need to wash your hands. So earlier it was just 20 seconds. Now we're talking about 40 to 60 seconds of washing with soap and water under the tap. So these things are very, very important. The other thing I would like to point out is the time for which, you have to maintain that temperature of your food. So the science has taught us that between 5 degrees centigrade and about 63 to 65 degrees centigrade is what is known as the danger zone. This is the zone in which the microbes will not only survive, but they will happily grow and multiply. So we have to keep our food either below 5 degrees, which is something like a refrigeration temperature, which is 4 degrees centigrade.
Right.
Or freeze our food, which is like minus 18 degrees centigrade. Or if you have to keep food hot, then it has to be above 65 degrees centigrade. And if you've kept food at room temperature in 2 hours, the microbes would have multiplied to such an extent that it actually becomes unsafe, especially in our tropical country where the temperatures are high. So not for more than 2 hours, you cannot keep cooked food outside. You have to refrigerate if you're not going to eat for 2 hours. Okay, within 20 minutes, the microbes can double their number at ambient temperatures in something like summer, and if the conditions are favorable. So we have to remember all these things. Also, when we put our food in the fridge, I think we really need to drill this in, that when you eat it, please reheat it. Don't just take it out of the fridge and eat it off. So you have to reheat that food, because while it was in the fridge, even though the temperature is low, the microbes could have multiplied to a number which can cause foodborne illness. So it has to be heated. It has to be heated to a particular temperature, which is like at least you have to heat it to 75. And you have to cook to 75. And the core of the food should reach that. So most of us don't have thermometers at home. How will we know? So generally when we talk to the public, we say, if it's a gravy item, just boil it and that'll kill it all. Or if it is a solid item, just sprinkle some liquid, water on it and heat it thoroughly, so that at least, you can see the steam coming out of it. So that's that's how we tell normal people that that's how you monitor. But these things are so important, and, many of us get lazy and say, water. And if you're reheating also, you'll heat it to lukewarm and just have it then. So that's no good. You have to heat it to a high temperature, and then only it'll be safe to eat.
Very interesting that, and how we need to catalyze change. On that note, we are going in for a short break. Stay tuned.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination, with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back, and we're in conversation on food safety and sanitation and hygiene. All right, Dr. Pulkit, you just told us just before the program about heating and cooling food and how important it is to take into consideration that even if we refrigerate, we need to boil it to a certain temperature to kill the microbes. My next question to you is, supposing there is an item like kheer or ice cream in the refrigerator, how many microbes would multiply on that?
So yes, it's a very good question, and so that's always a problem, because there are foods which you're going to consume cold. Then you can't reheat them and then recool, and then you're back to square one. So something like ice cream, if you're storing at minus 18, then we don't expect the microbes to be multiplying at that kind of temperature. And for the other foods, we have to be very careful. Anything which is eaten raw, anything which is eaten cold, you have to maintain absolute hygiene for that, so that to start with only you don't have so many microbes that they would multiply. Also, do not keep food in the fridge forever and ever and you're eating the whole week long, because again, and the other thing what happens in homes and even in food businesses is that you have this one fridge and you're going to stock it up with everything, and it is absolutely jam-packed. Now, what happens in this case is that the temperature will not be it won't be less than 4, or it won't be 4 degrees. It would have risen. That means now your microbes are multiplying more. So do not congest and jam pack your fridges. It has to have a circulation so that the microbes, the temperature doesn't rise there.
Absolutely. Here, I'd like to ask you, as India looks at Unlock 4.0, how important do you think is the message that should go out to all our restaurateurs and all the people eating out to take care of food spoilage and microbes as such?
Yeah, that's again a good question. Like spoilage, as we know, is that actually changes the color and texture of the food. However, we can see that it doesn't at times cannot be unsafe. So the main things what can prevent the spoilage of food is by adding some additives. Right now we are using the newer technology, like we add food additives to the food, and so that the shelf life is increased. Or we do one thing, the storage temperature, which Dr. Fulkit has just now told that how we have to store and at what temperature we need to store our food. But as far as the restaurants are concerned, so they also have to see to it that their storage facilities are well developed. In the establishment or in a food business operator, they have to see that what are their establishments and whether their storage facilities are as per norms. Like if they need to store something at a cooler temperature, that has to be maintained either at -18 or below 4 degrees centigrade. And if it has to be a prepared food and that has to be served hot, that needs to be cooked at least at the 75 degrees Celsius. And then the holding temperature, that is called hot holding, that has to be above 65 degrees.
Yes, Dr. Pulkit, another question that just comes to my mind is, what are the guidelines now? Can you tell us about the preparation of, disinfectants, about sanitization of surfaces, touch points on food items? That's also an important guideline.
Yes. So all these are there. There are two documents which have been taken out by FSSAI. There's a guidance note for the food business operators during COVID. There's also an Eat Right during COVID. So both these have in great detail the kind of sanitizing and the disinfecting substances that you can use. Primarily there are three types. One is alcohol, so that should be whatever disinfectant you're using, it should have more than 70% alcohol in it. Then second is chlorine based ones, and the third is quaternary ammonium compounds based one. So in detail in these two guidance documents, there in the annexures you will find tables which tell you what are the different types of these compounds which are available. So some are available as liquid, some are solid powders or tablets or whatever. So they have explained in great detail how to make the relevant dilutions so that you get an effective disinfectant or a sanitizing agent. So these are to be used on different types of surfaces, and that's how you can ensure and get rid of the microbes.
Can you throw some light lastly on food storage and how food should be served, say from restaurateurs to their customers, or from serving in a family?
Right.
Or at home to people who are eating, or by street vendors? What is your take on how to keep this absolutely COVID-free?
Right, yeah. Actually, as we know that as far as this document is concerned, we already have highlighted those things, like how if person is going to a food services where we have to eat ready to eat foods, so there how it has to be served. Especially the food handlers need to take a lot of precautions. They should wear mask while they are serving, or if person is actually
gloves.
taking gloves and mask and everything, and they have to actually follow all the norms like social distancing norms, or keep a distance of 2 meters away from the customers. And at the same time, there should be guidance for the customers as well. That means once they enter the premises, the temperature, there should be some temperature control check at the entry of the food premises, and if they have any symptoms, they should not be allowed to enter into the premises. At the same time, there should be a facility for hand sanitization protection of the co-workers as well as the handlers as well as the consumers. And if they want to take away in their own package, if they have got a bag or whatever they carry, then it's fine. But if otherwise, they can use some not the plastic bags, they can use the paper bags, which it easily can be disposed of. So these are some of the tips which has been given as far as our guidance note also talks about all this. And retailers, again, they have to maintain a distance of all those people who have to be in a queue and all that. The social distancing has to be maintained.
So a lot of new things have come in with COVID, and let us just hope that Bharat jeetega or COVID harega, and we need to adapt and look at change in all our life aspects to actually battle this pandemic and to win over it, especially in the aspects of food hygiene, safety, washing hands, water portability, and all of that. And on that note, I'd like to thank both of you for joining us today for this very, very insightful and interesting discussion. Thank you so much.
Thank you.
We are at the forefront of bringing in scientific change. There is a huge amount of work that is happening in the areas of food safety and science, and it will truly transform the food safety and nutrition landscape of India. Let us work together to make India truly happy and healthy. On that note, many thanks for watching. Keep watching India Science. Namaskar.